Operations Committee. This is voting list number 12. And I've got that we're being live streamed. And we're going to start with House Bills 96 and 74. Is there a motion to allow the sponsors to withdraw those two bills?
So moved.
Second.
All those in favor say aye. All those opposed, no. The ayes have it. We will allow those sponsors to withdraw their bills. House Bill 746 of cross-file SB 682. Okay, we got both of them at the same time. Aaron.
House Bill 746 requires Medicaid beginning January 1st, 2023 to provide coverage for medically necessary gender-affirming treatments in a non-discriminatory manner. There is a reprint on pages 7 through 11 of your packet. This reprint strikes language regarding the specific procedures that would be reimbursed under the bill. And it provides that Medicaid may not deny or limit coverage for gender-affirming treatment based on the program recipient's gender identity, and provides that Medicaid may not establish a categorical exclusion for a particular gender-affirming treatment. There is also a sponsor amendment on page 6.
Delegate Penny-Melnick, can you talk?
Yes, I can. Thank you, Madam Chairman, and thank you for your flexibility. We discussed this bill in subcommittee. Thank you, Aaron. It was not unanimous. It was basically party vote. And I move the amendment.
Second.
Is there discussion on the amendments? All those in favor say aye. All those.
There's a hand up.
There's a hand up.
Delegate Johnson, I'm sorry. Delegate Johnson, your question.
Thank you, Madam Chairman. And my question is, with the amendments, does it still state medically necessary? Was it saying they cannot deny? So is it still for medically necessary?
Yes.
Okay, thank you. Thank you, Madam Chairman.
Any other questions or discussion on the amendments? All those in favor, please say aye. Oh, Delegate Krebs.
Thank you. So can somebody tell me what medically necessary, the definition of that is?
Madam Chair.
Well, Delegate Penny-Melnick may want to answer it. If not, Delegate Kaiser may.
Medically necessary is basically defined by the medical profession and the opinion of a professional, a doctor. If they find that this treatment is important and necessary for that person to improve their health, their mental health, their physical health, in the judgment of that medical professional, once they have actually done a diagnosis. So under the bill, you have to be diagnosed first having gender dysphoria. A person who has gender dysphoria is basically can only apply to a transgender or non-binary person. Once you are diagnosed by a professional, a doctor with that, then they decide what is the treatment that is medically necessary to improve your life. I don't know if Delegate Kaiser would like to add anything else to that.
Only if people need more technical language, because I have the.
No, I was just trying to decide where in the bill changed, where in the bill on the part about the cisgender, where is that? What page is that on?
Are you looking for the medically necessary language?
No, about what? Yeah, yes.
So if you look on bill page 2, lines 24 to 28.
Oh, you're not looking on your handwritten page number. You're looking.
I'm probably handwritten page 8 is my guess.
Yes.
Lines 24 to 28.
Mm-hmm.
So gender affirming treatment means any medically necessary treatment consistent with current clinical standards of care prescribed by a licensed healthcare provider for the treatment of a condition related to the individual's gender identity. And then there are specific underneath that. Gender affirming treatment includes hormone therapy, hormone blockers, and puberty blockers. And then it goes down to that illustrative list.
No, but Delegate Penny-Melnick mentioned about when they get diagnosed, how they determine what if a person has this dysphoria. Where's that? She mentioned she went on to elaborate more than that. I could not find that in the bill about dysphoria, gender dysphoria, or something.
I don't believe that exact. Kaiser can answer, but I don't believe that exact word appears in the bill.
Yeah, that's not in the bill, but gender dysphoria is defined in the bill. and medically necessary as well, but the only person that can make a diagnosis is a medical professional.
Oh,
My
sorry.
question is,
Sorry, I did find it.
show me, just what page is that on?
Bill page 4 of 6. So this is the list of things that would be covered under the bill, and it's lines 9 through 13.
No, the part where she talked about
It says
how
gender
a
dysphoria.
medical professional would make this determination about gender dysphoria. I'm just looking for that in here.
So that is the. go
That
ahead.
wouldn't be in the bill, Erin, am I correct? Because it's a diagnosis made by a doctor, like they will make a diagnosis with any other condition. So that's not in the bill. That is up to the professional who's a doctor who went to school to learn about different conditions. What if that person comes to them, whether they meet that criteria, and they make that judgment. I don't believe that's in the bill.
Okay, I'm just trying to figure out what direction
We
we're
also
giving.
don't define cancer or other diseases in legislation.
We're given direction in this bill to a medical professional. And I read where it says it's the intent of the General Assembly that the program provide gender affirming treatment to all program recipients for whom gender affirming treatment is medically necessary, including transgender, non-binary, intersex, two-spirit, and under gender diverse individuals. So is that what you're talking about? That is that the direction that you're giving to the medical professional? That's why we're making this law.
Right, so we're making this law that basically requires Medicaid to cover an individual who has gender dysphoria to be able to get the treatment they need. That condition is basically decided by the doctor. So the bill is to allow Medicaid to cover these procedures. It is now very general, not specific, but the decision is made by the medical professional.
Okay, I'm sorry. And I just couldn't find the word gender dysphoria anywhere. I couldn't see that in this language, but
There is one reference to it.
okay. You keep talking about gender dysphoria, but I just haven't.
Where
seen
is
it.
that?
It is, it's bill page 4 of 6. And then it's lines 9 through 13. And this again is the illustrative list of covered services, potential covered services. Other treatments as prescribed to suppress the development of endogenous secondary sex characteristics, align the individual's appearance or physical body with gender identity, and alleviate symptoms of clinically significant distress resulting from gender dysphoria.
Okay, I see where it says resulting from gender. I see that. It doesn't seem to say that throughout the bill. That's okay. Thank you. Thank you for explaining that.
Thank you for your question, Delegate Krebs. Are there any other questions? Delegate Chisholm.
Thank you, Madam Chair. I guess more of a question of clarification. When you're on bill page 3 of 6, we start to get into all the different, I guess, types of procedures. And the bill's been amended and strikes out, very descriptive language. I don't understand. Why do you feel like when you say alterations to abdomen, chest, trunk, and buttocks, that encapsulates everything that's below there? I'm just kind of confused on why.
I'm going to handle that. We have a policy in this committee to try to avoid laundry lists. Laundry lists include things, and sometimes they don't include things. And when you have a laundry list that includes things, the implication is that it may exclude other things. So we try to just be general and give the medical provider the leeway to act within the scope of his or her practice. Does that answer your question, Delegate Chisholm?
Yeah, because I saw some things in there, not that I'm for this bill, but I thought we were excluding some pretty important stuff if you guys get the bill through, like mastectomy. So, all right, now it makes sense to me. You're saying that it's probably still gonna be covered. It's just not, you're not putting yourself into a corner. Okay.
Correct.
Thank you, Madam Chair.
My pleasure. To quote a friend. I see Delegate Morgan, and then I see, go ahead, Delegate Morgan, then Delegate Kaiser.
Do you want me first or Ann? I'm sorry, Madam Chair. I thought Ann had her hand up first.
Oh, okay. Anne, why don't you go ahead and go first?
Yeah,
Kaiser.
thank you, Madam Chair. Thank you, Delegate Morgan. I just wanted to also add for Delegate Chisholm, the amendments of striking out all that language came from MedCai, who is in support of this legislation, and they were worried that other named things might come up later. So as the charity said about not having a list which naturally excludes things. So yes, what it's been amended down to covers all the things beneath, but potentially something that could come up later in time.
Okay, thank you, Delegate Kaiser. Delegate Morgan.
Thank you, Madam Chair. Just a question as a matter of the policy that we're setting here. Do we make other, I guess, cosmetic surgery or other, I would think, mental diseases? Like if somebody is obese, do we allow for cosmetic surgery for those same people? Because it wouldn't fall under medical necessity.
Madam Chair?
Delegate Kaiser, go ahead, because I know the
See,
delegate.
everyone's hands up now.
Well, part of the answer, Delegate Morgan, to answer your question is that being transgender is not a medical disease. So that's the first part.
No,
of
I
the
said mental disease, which is gender dysphoria is a mental disease. I mean,
gender dysphoria. So this bill is about gender dysphoria. And again, the cosmetic surgery that you're describing still has to be based on gender dysphoria and still has to be based on a doctor's decision about medical necessity. It still has to be based on the standards of care. And of course, I'm sure you realize two things. One, only some fraction of the procedures that actually get done in the transgender community are actually plastic surgery. And then we also know that sometimes mastectomies, cleft mouths, I'm not describing it right, Dr. Hill can clarify, but there are certainly things that are considered cosmetic, but that are also medical necessities.
I'm just asking, is that
Yes.
part of the
yes.
problem? Okay, so it's under Medicaid. Some of that was like the example I used, being more obese. I mean, they would qualify for some of the cosmetic surgery, like in the Adam and whatever we changed the amendment to, Adam trunk, chest, same prescription under this bill.
I think Delegate Kelly was going to answer that part.
Okay, Delegate Kelly.
Oh, you're muted.
I'm muted. I can answer that Medicaid does cover gastric sleeve and gastric bypass surgeries for morbidly obese people for whom it is medically necessary.
But would they cover the cosmetic portion afterwards? That's what I'm asking.
Delegate Morgan, if it is medically necessary, it's covered. And if it's not medically necessary for a diagnosis, then it's not covered. And that is beyond what we get into the weeds on.
Okay. All right. Well, thank you, Madam Chair.
Sure. I'm going to go to Delegate Hill first because she's actually quite an expert on these things, and it's nice to have that. And then I will go. Somebody else had a hand up that's gone, but Delegate Hill, let's go to you first.
Well, Madam Chair, you just said this is not what we're going to get into there, so I'm just going to tell Delegate Morgan we can talk about it offline if you first, or I can share information with the group. That's up to you all.
That'd be fine.
Thank you.
Is that okay, Delegate Morgan?
Well, since we're just having a little back and forth question, if you wouldn't mind, Delegate Hill, yesterday we asked the question in committee dealing with Medicaid and how many cosmetic surgeons are out there to actually take Medicaid. Is there a lot? Because I know that the reimbursement for Medicaid is quite a bit lower than Medicare.
So in Maryland.
Yeah.
So let me just, the quick background. So you talk about plastic surgery. Plastic surgery traditionally is about 70% reconstructive, 30% cosmetic. Okay. So most of it is insurance covered stuff. People take their practices in all kinds of directions that can go completely cosmetic or what have you. Okay. That's a different question than what services are covered. As the chairman said, the determination of whether a procedure is covered is largely based on whether the provider is saying that it's medically necessary for this particular patient. Okay, and I say largely because very often insurance companies will say, I don't care what your doctor says, we're not going to cover it. We're not even going to tell you it's not necessarily, we're just saying we're not covering it. So if you need it, you can pay for it. The classic examples would be breast reductions, which for many women will be considered cosmetic, but for women who have back pain, shoulder pain, chest pain, carpal tunnel syndrome, and other conditions, the doctor may say this is a medically indicated procedure and then have to jump through a whole lot of loops, depending on the insurance company, a whole lot of hoops to try and advocate that it should be covered, but it may not be. Okay, so hopefully that helps. So, and there are many things you asked about obesity. Delegate Kelly explained that procedures to deal with the medical consequences of obesity are often, but not always covered. The skin that's left over and hanging down may or may not be covered to have that removed, depending on whether it's presenting medical problems and what the insurance company is covering, including Medicare. So if the hanging belly, as a result of losing the weight from the gastric sleeve, is causing rashes and skin breakdown, or is weighing on the back and causing back problems, then most insurance companies, including Medicaid, would likely cover it, but you still have to make the argument for why the procedure is medically indicated for this person. So what this bill is saying is there are certain procedures that in certain groups would be considered completely cosmetic. And this is allowing or requiring that if the practitioner, the physician is saying, for this person, this is medically indicated. This is more than just, I want to look better than that, right? This is more than it makes me feel good to have my hair dyed. This is causing some significant problems, and they're saying that they believe that it needs to be covered. And insurance companies then have their own processes of whether they're going to agree to it. And what we're saying is for Medicaid here in Maryland, if the medical provider is saying there are medical indications why this is necessary, we're not putting the insurance company, which has no clinical background or input and is simply making dollar and cents decisions. We're not allowing them to veto the decision of a medical provider on something they know nothing about.
Okay, got it. Thank you for the information, especially on the Medicaid, like the 30-70 ratio that you threw out, because I think a lot of us, you know, at least I was, when we're talking cosmetic surgery, the first thing we think about is the for-profit, the truly.
Right. You think of plastic surgeon as being cosmetic, and I think about it, and I can.
And look, I knew a lot of that falls on
reconstructive versus cosmetic and what it means. We can talk offline.
Yeah, I knew a lot of it fell under reconstruction for like burn victims and stuff like that. So yeah, I appreciate the information. It's very thorough. Thank you, Delegate Hill.
Okay. Delegate Kaiser.
Thank you, Madam Chair. I just wanted to answer another one of Delegate Morgan's questions, and thank you both to Delegate Morgan and Delegate Saab, who asked the question of the number of plastic surgeons who take Medicaid. It's unfortunately a low number, and whatever we can do to enhance that, more than 5 would be better, but I appreciate your concern that there's probably not enough doctors who accept Medicaid, plastic surgeons who accept Medicaid. So, but they do, and they're out there. And again, this is about patients finding them and being able to get it covered. So thank you, Madam Chair.
Thank you. Delegate Kerr.
Thank you, Madam Chair. Something just occurred to me. Would there be a situation where the physician who determines this to be medically necessary also be the physician who's going to perform the surgery and likely receive payment for it?
Yes.
Okay, thank you.
That is standard, Delegate Kerr. When a physician wants to perform a surgery in their scope, they're the expert. We trust that physicians don't perform unnecessary surgeries. We have seen some examples of that not being true in historic time, but before your time, in the General Assembly, that is. Delegate Cullison.
Thank you, Madam Chair.
I think this is a question either for the vice chair or perhaps Aaron. It's my understanding that commercial carriers now pay for the gender affirming treatments when medically necessary. And if so, then isn't this bill just seeking equity for those who may not have able to afford commercial insurance?
That's correct.
Thank you.
Should I say my pleasure?
It would be characteristic. I see no other hands. So with that, the amendments have been moved and seconded. So all those in favor, please say aye.
Aye.
No, please raise your hand, and I'm opening the reactions. No, I don't want to do that. I want participants. There we go. Okay. I see. I'm going to name them so we don't miss any. We have Delegate Kipke, Delegate Krebs, Delegate Morgan, Delegate Chisholm, Delegate Saab, Delegate Sample Hughes, Delegate Riley, Delegate Landis are no votes. Can somebody give me the tally of that vote count, please?
I have 9 in the red.
I think that I just counted, I thought I read off 8. Did I read off?
8.
I believe I read 8. And on my screen now, I only see 7. I'm not sure why I only see 7. I seem to be the 8th. There we go. There's the 8th. Okay, I see 8. There are 8 red votes, but I'd like to know the tally of the green votes. And I want to make sure we've got the right people. So let me try again, Richard. We've got Delegate Krebs, Delegate Morgan, Delegate Chisholm, Delegate Saab, Delegate Sample Hughes, Delegate Riley, Delegate Landis, Delegate Kipke. That's 8. Got it?
Got it.
So now how many are there in favor?
Don't forget somebody's excused. Delegate Shalika's excused.
Right,
That's right. Yep, we have 15 in the green.
15 in the green. Okay.
Madam Chair, is Delegate Bendari on here?
I
Yeah. Oh, no.
Delegate Bendari, are you there?
Looks like he left.
Then he did he? I don't know when he left. So assuming that he left, he's not voting because I don't have him on the screen. If anybody knows that he was here, that's fine, but I don't. So I will not put him in a yes. So I believe that is 14. Right?
Yes, ma'am.
Okay, that's important. And we can go to roll calls if we need to, but I think we're okay. If the members are comfortable that that's accurate, I don't want anybody to feel that something has happened that isn't accurate. Okay. All right. Thank you. Now with that was the amendments. Is there
I move the bill as amended.
Second.
Is there any discussion of the bill as amended? Delegate Saab.
Thank you, Madam Chairman. I think this was mentioned before. So this is the House bill that we're voting on, correct? Not the Senate bill.
It is the House bill, correct.
Okay, is the Senate, I know we heard the Senate bill, so it's not on this list. So
No, it is. It's later in the list. It's
It is. And maybe we'll vote on it right after this, just to have them both consistently at the same time. How about that?
Okay,
think
I'll
that's-
just,
Yeah,
okay, but my question was going to be, and I can ask it, just are they in the same?
Yes,
Posture,
yes,
yes,
they are.
Thank you.
good question. All right. Do you want to just have this vote be recorded for everybody the same on the Senate bill? You think that's legal, Aaron? I see Delegate Kerr's hand
Say
up.
Senate Bill is 682, and just call the vote on that, just to say it out loud.
Okay, Delegate Kerr, do you have your hand up for a reason?
I do. I'd like to ask a question, Madam Chair.
It can't be on the bill we voted. Is it something, I mean, we're gonna be voting on the Senate version in a minute, so you can, but if it's procedural, go ahead.
Oh, I just want to clarify one thing that I think I heard Delegate Pena-Melnick say, that
If it's about
the
the
kid-
bill, can you wait till the Senate bill? Because that bill is gone.
Okay, sure.
No,
I'll
we
wait.
only voted on the amendment.
Oh, I'm sorry. Okay, good. Delegate Kerr,
Okay.
I'm out of order and you're in order.
Thank you. Delegate Pena-Melnick, did you say that this procedure is currently covered by carriers?
Yes, by commercial carriers, they do cover gender affirming treatments.
So what we're doing is we're conforming Medicaid to what is already covered by commercial carriers.
That is true for the very poor, to make
Okay.
sure they have the same access.
Okay, thank you. Very helpful.
My pleasure.
Delegate Hill, then go ahead. Delegate Kelly.
I just wanted to clarify something. I know the vice chair has said it, and I know Delegate Kaiser has said, I'm just not clear it's gotten through, because people keep talking about the procedure. We're not talking about a procedure. We're talking about a range of treatments, which include medications for some people, which include hormone replacement or hormonal therapy for some people, which I presume might even require, and for some people, some psychiatric or psychological counseling services, as well as surgical and non-surgical procedures. So there is a range of stuff we're talking about, not simply a procedure. And I think it's important for the members of this committee to understand it more broadly than a simplistic idea that we're talking about, I'll say it, taking off breasts or inverting a penis.
Delegate Hill, would you say that medically necessary treatment is a better way to summarize that in a phrase?
Well, the bill talks about treatment, but we keep
Okay.
saying procedure.
Well, thank you for pointing that out to us, because medically necessary treatment is a better way probably to say the scope of what you're talking about. Thank you. Okay, Delegate Kelly, followed by Delegate Krebs.
Thank you, Madam Chairman. And I just wanted to follow up, I think, on what Delegate Hill was saying, and particularly point to the fiscal note, because I think one of the things that's most important to me as I consider this bill is, in Medicaid right now, there are about 2,000 people who are enrolled who are transgender, and that I think it was 98 individuals last year received gender affirming treatment. This bill is about making sure that everyone who needs that gender affirming treatment can get it. So the fiscal note estimates it would be about an extra 25 people who've been facing barriers, who have a medical diagnosis, who need this medically necessary care. So I just wanted to, put on the record the scope of this bill. It's for a small number of vulnerable people who need treatment.
Thank you very much, Delegate Kelly. I'm sorry that the vice chairman is between things. She's here, but it's awkward for her to be talking a lot. So it's good that we have other people in this discussion.
Thank you.
Thank you.
I appreciate it, Chairman. I do, and all the questions.
Mhm. Delegate Krebs.
Yes, I just want to follow up what Delegate Kelly just said. So in the fiscal note, it says currently, in current law, Maryland Medicaid currently covers gender affirming treatments for individuals that are 18 and older and have the capacity to make fully informed decisions and consent for treatment. So the way I understand it, so this bill is specifically targeted to youth under the age of the 18. Is that correct?
That is not correct. If I may, Madam Chairman.
Go ahead.
Is not correct. You cannot get surgery in Maryland if you're under 18. You can get the hormone treatment only with the consent of the parent if you're under 18. But no, this is for adults. And the issue right now with Medicaid is that they do not cover everything. So the bill brings it up to date to what the commercial carriers are doing to make sure that people have access to the treatments that the doctors think that is medically necessary treatment, but it is not for kids.
Okay, so basically, Medicaid currently covers all these things. It's in the fiscal note. Have 2 referrals from a qualified medical health professional. Is that still the same? That they still have to have 2 referrals from the qualified medical health professionals?
Depending on the treatment, yes. Different treatments have different requirements.
No, because I'm following up because of what Delegate Kerr mentioned about, will the same person be making the diagnosis as doing the treatment? Because I just want to make sure it's the same as, so currently Maryland Medicaid covers gender affirming treatment for individuals 18 and older. And you're telling me that it doesn't cover everything. And that's why this bill is necessary. And it's staying,
That's correct.
and it's staying the same. I just want to verify this so we have it on record. And it's staying the same, that the individual must have 2 referrals from qualified mental health professionals who independently assess the individual. So currently treatments are reimbursable by Medicaid that do psychotherapy, hormone replacement, outpatient laboratory testing, specific procedures for individuals transitioning from male to female, blah, 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 as medically necessary for transgender persons. I'm trying to figure out what's different from now, because it seems like they're already allowing for most of this for people over the age of 18. And that's why I'm trying to figure out what's different about this than, so there's nothing under the age of 18 in this bill. And we've just taken away the laundry list. So what's the difference in the language we have in the bill now and what it already covers, that it says post-transition, specified procedures for individuals transitioning from male to female or from female to male, and post-transition services as medically necessary for transgender persons appropriate to their anatomy. So what is different than what we're doing now?
If you read in the fiscal note from that, where you're reading from, the last paragraph points out how the bill is different from current.
Okay, so, but we said we weren't going to have a laundry list anymore. So now it sort of covers everything: hair alteration, treatments, voice modification, alterations to the abdomen, trunk, buttocks, additional surgeries to the face and neck, fertility preservation services, which are not now covered for any Medicaid participants for any reason. So when I think, I know we don't like laundry lists, but I think now we've opened it up to some of these folks are actually going to have more access to things that even other gender affirming people have. I just saying, because it says fertility preservation will be included. I don't know that we do that for Medicaid now. For gender, I don't even know how to call all the genders anymore. But again, I'm trying to figure out. Seems like we're leaving other people out now for some of these things. I mean, what if you're a female currently, and you have hair loss, and you're very much, it's very difficult for you.
Delegate Krebs, this bill is only about a particular diagnosis. And you are correct. If you have these other conditions, if they are considered medically necessary, they're somewhere else in the rules, either with private or Medicaid insurance. We're not going into that.
All right, so let's just clear it up. So currently in Medicaid, over the age of 18, you can get these things anyway, but some of it is more of the cosmetic stuff that is not covered, which is the stuff that was in the laundry list is now out of the laundry list. But the other transition things were already covered under Medicaid, to specify procedures as medically necessary for so that's already in law, medically necessary in Medicaid. So we're expanding that to more, I call it cosmetic. You have hair loss, or you don't like, something, it's not breast reduction, breast implementation, whatever. That's more, I guess, cosmetics. So I just want to make sure everybody knows what it is we're adding to Medicaid, because currently we do spend money on Medicaid to do medically necessary procedures, because it says it right here. Anyway,
Delegate Penny Melnick.
Yes, this bill does not deal with cosmetic surgery. This bill deals with a person who has been diagnosed with gender dysphoria, that is a transgender individual, who is really under excruciating psychological trauma. And the doctor, who's a professional, decides that it's the medically necessary treatment to help their condition. So the bill is drafted in general language, not a laundry list, so that we don't leave anything out that a doctor or professional decides that that is what this individual needs to improve their condition. What we did not want to get so specific that we miss something that a doctor decides that it's needed. And whatever is out there that is the best treatment or the treatment that is best for this condition, hopefully Medicaid will cover it. Presently, they're not covering everything. That is why the bill is drafted in that manner. But I want to make the record clear. This is not cosmetic surgery that I'm losing my hair and I want to get, have some treatment so that I can grow hair. This has to be connected to the gender dysphoria diagnosis in the best judgment of the practitioner.
Delegate Bagnall.
Thank you, Madam Chair. And I think I understand, but correct me if I'm wrong, and this is probably for the Vice Chair or for Delegate Kaiser, that that MedChi was comfortable with this language and amending out the laundry list because it's already in the standard of care for gender affirming treatments for body dysmorphia. Body dysphoria? Is that correct?
I believe so, Delegate Bagnall, but I think it's also because, again, they were concerned that something else could come up later and they didn't want to exclude it.
Thank you.
Okay. Delegate Hill next.
Yes, Madam Chair. So I want us to be clear that at least as I read the bill, Delegate Krebs is not wrong. So that a woman who is cisgendered and has a hairy face generally will not be covered for hair removal. Okay? But because of the diagnosis of gender dysmorphia and how that plays in, we are saying that if the treating physician thinks that hair removal for the trans woman is medically necessary, not simply because they carry the diagnosis of being a trans woman, but because there are other things for that particular patient that make it medically necessary. But Delegate Krebs is not wrong that there are many things that patients think would be helpful that they're not going to get. And most often, they're things that you guys call cosmetic, where the treating practitioner themselves are saying it's not really medically necessary, right? Like, I know you want it, but it's not medically necessary. It's not really causing some other problem. With this diagnosis, those things, including hair on the face, for an average woman might be discomforting, embarrassing, a pain in the butt, whatever, but that doesn't make it medically necessary. And they would be hard pressed to find a practitioner that would say, for either losing hair, we're going to do hair transplants, or wanting to get extra hair off, that that's medically necessary just because it causes you psychological frustration. That doesn't make it medically necessary. So I hope that helps, but you're not wrong, right? So these same procedures would not be given for someone without the diagnosis.
Okay, thank you. Delegate Johnson, then Delegate Chisholm.
Thank you, Madam Chairman. And I want to be able to just make sure I understand. We've thrown a lot of stuff out because, I want to be able to explain my votes on bills. So I'm a little confused about an issue. We've talked about gender dysphoria and about emotional distress. But yet we talk about a physician deciding if it's medically necessary. So the definition of gender dysphoria is the condition of feeling one's emotional and psychological identity to be in variance with one's birth sex. So, someone asked the question a little while ago if we're getting a second opinion. So is a psychologist or psychiatrist making a determination that they're psychologically at harm, or is the physician making the decision of medically necessary? So we've talked about psychological. So who's making that decision? If anybody can answer that. And do they have to get a psychological evaluation before it's deemed medically necessary? If anyone knows.
Aaron, I assume this is not in the bill. I assume that the doctor or doctors, which there probably are in these cases, treating the patient would be making the decisions. Is there anything that speaks to this in the bill? And then I'm going to call on Delegate Hill.
The bill in the definition, I'm sorry, in the definition of gender affirming treatment, it is that it means any medically necessary treatment and then consistent with current clinical standards of care prescribed by a licensed healthcare provider for the treatment of a condition related to the individual's gender identity. So there is a reference to a licensed healthcare provider, and there is a reference to it being consistent with current clinical standards of care.
So it would be presumably the appropriate provider for.
Yes, and then however that determination is made, that the individual needs, that the treatment would be medically necessary, would have to be consistent with current clinical standards of care.
Thank you. And I'm going to go out of line here and let Delegate Hill answer, because I think she brings a perspective that we need sometimes for these technical answers. Delegate Hill.
Okay, so not unique to Medicaid. The fact, what this bill, as I understand it, does is it says to Medicaid, this is a covered service. It does not tell them how they go about determining which patients will receive it. Yes, it will require that a provider say this is medically necessary, but I guarantee you Medicaid will then have a process where the provider will basically apply and advocate that this patient falls and is able to document all of the things that Medicaid then requires. That's what all the insurance companies do. It's rarely that a doctor sends a letter saying medically necessary. It's always, I say that's medically necessary. And then they have a process where you prove what clinical support there is that indeed indicates the medical necessity. So you say as a physician, say, or a provider, it's medically necessary. The insurance says based on what? Based on what do you say medically necessary? So Medicaid will set up a process. It's not going to be the doctor saying, as someone suggested earlier, I think you need this medication, I'm going to prescribe it, and they're going to have to cover it. They will have a process that the provider will have to go to justify that decision. And I think Delegate Kelly could maybe add to that, but that's generally how it goes.
Thank you, Delegate Hill. I think that leads to the whole process that we have for appeals and grievances, which means that what happens is if the doctor and the patient feel that it's necessary, and the insurance company in general, and I'm not using Medicaid as the example, I assume they fall under this, but I don't honestly know. If the insurance company says it's not, then and issues an order saying, no, we're not going to pay for it, then there's a process that goes through a higher level, including the insurance commissioner's office. And there's a whole process in place, which I'm happy to have been a part of setting up. So yeah, it's a complicated process. So the insurance companies and Medicaid are not in the business of just paying for whatever anybody asks for, I assume. I know that about the carriers. I don't know that for sure about Medicaid, but I suspect they're even more so. Delegate Chisholm.
Thank you, Madam Chair. 2 bites ago, Delegate Hill confused me, and maybe she just straightened this out. But the crux of the bill, as it was brought to us originally and the subcommittee, was we have a horrible problem that 60% of transgender people either commit suicide or attempt suicide. And when she said, well, the doctor will have, a physician will have a consultation with the individual, and they may say, well, you don't this isn't medically necessary. You may want it and it might bother you mentally. Well, then it goes against the crux of the bill. So based on what you said, I'm just going to accept what you guys just said, that Medicaid and the physicians will figure out what is medically necessary and what is appropriate. So no question.
Okay, thank you, Delegate Chisholm. Delegate Lewis, followed by Delegate Saab, followed by Delegate Kaiser.
Thank you, Madam Chair. I might have mistimed this, but I wondered if having moved the bill as amended and seconded the bill as amended, if it was time to move the bill.
I would rather answer all the questions first.
Thank you.
I appreciate your thinking, but I think it's
My
best.
timing was off.
Yeah, I think that what we want to do is finish the questioning. You can raise your hand again and be at the end of the line if you want. I'll put you there regardless of who else pops up if you want. But it's moved and seconded. Delegate Saab, then Delegate Kaiser.
Thank you, Madam Chairman. I just wanted to get a clarification. I heard the number 25, and I think Delegate Kelly is the one that said that this bill will affect 25 people. Did she mean, I guess the question, is it 25 potentially that can benefit from this?
Delegate
coverage?
Kelly, let's let Delegate
What do we
Kelly
know?
answer. Yep, let's let her answer. I think she read it in the,
Yes, I read that straight out of the fiscal note. It was a projection of people who are currently seeking treatment that would have barriers removed by this legislation. So it said about 100 people last year received care. They estimate that by passing this law in the next year, maybe it'll be 125. So it's not massively increasing the number of people who are able to access the care they need. It's just allowing easier access, more equitable, appropriate access for the people who need the care.
So you said 125, not 25. It will affect 125.
It would be a total of approximately, it's an estimate, 125 people in this year, whereas last year before passing the legislation, it was 100 people.
So how do they know that if they haven't diagnosed what's medically necessary, what's not medically necessary? How can they come up with this number? Because we don't know what, it's all based on individual patients. So how do we know what's medically necessary to guesstimate that number?
I think this is
questioning,
a projection. This is a projection that they made based on the data they have within Medicaid over the past several years. It's a best estimate.
Right, but they never covered it before.
Well, I think that's
So
the point that I was trying to make by reading that part of the fiscal note, is that there are people already under Medicaid that are able to access this care, but there are barriers, and not everybody is everybody who needs it is consistently able to access it. So that's why we need the legislation. So it's not that it was not covered at all.
Okay, I'm sorry, Madam Chair. So I'm confused. So we are already covering it now, and this is just going to make it easier to cover? Is that what, in other words, is that what it is? So we are already covering it?
That's what it says in the fiscal note. Yes, that this care is already covered, but it is inconsistently applied, and that particularly the most vulnerable people are facing barriers and not always accessing the care. So that's why we need legislation to clarify that Medicaid needs to cover this.
Okay, all right. Thank you, Madam Chairman.
Delegate Kaiser.
Thank you, Madam Chair. I've heard a lot about medical necessity and standard of care and doctor judgment. And I'm glad we do have a doctor on the committee who can answer the questions. But if other people want to see the list of organizations like the American Medical Association, American Academy of Pediatrics, American College Health Association, American College of Nurse Midwives, all these different groups, all the medical professionals are believe that that treatment is needed for gender dysphoria. And so I'm not sure why we would substitute their judgment in this case. We are not medical experts outside of Dr. Hill, who seems to understand this bill. So I don't sense that we ever question other doctors for their decision-making in the way that we are seemingly doing so in this case for one part of the population who not only experiences gender dysphoria, but experiences a lot of violence and discrimination at the hands of other people. So that I'm hoping it's time for us to vote on the bill.
Thank you. I don't see any hands up. Delegate Hill, your hand is down. Is that accurate?
Yes, I have, Delegate Soppett asked about the estimate, and I was going to say, I'm sure they could estimate based on the number of denials that they give out every year, how many people ask for procedures that they say no to.
Right.
And they're saying it's about 25 people who they're saying no to things that might end up being covered now.
Okay. I see no more questions. So all those in favor, please say aye. All those opposed, no, please raise your hand so that we can count specifically. Actually, we're also going to count the yeses. Let's count the noes first because your hands are up and that's working well. On the bill, we've got Delegate Kipke, Delegate Morgan, Delegate Krebs, Delegate Chisholm, Delegate Saab, Delegate Riley, Delegate Sample Hughes, and Delegate Landis saying no. And let's just do a count of yeses because I want to have this carefully recorded. So all those who are opposed, take your hands down, please. All those voting yes, please raise your hands. I know we don't usually do this, but I want to get it right and I want to make sure we're not missing people who might not be voting. I see Delegate Hill. Oh, I haven't put my hand up. Where's my, put me in the yes column, would you please, Richard? I'm the first. Delegate Hill, Delegate Kaiser, Delegate Bagnall, Delegate Belcastro, Delegate Rosenberg, Delegate Kelly, Delegate Cullison, Delegate Kerr, Delegate Carr, Delegate Lewis, Delegate Lewis Young, Delegate Johnson, and Delegate Pena-Melnick. I count 14.
That is correct.
Okay, I'm glad that we all are in agreement here because we want to be correct on this. Okay, you may all put your hands down and I thank you very much for going through that. I'm going to take a sort of a pro forma vote. I'm not going to make us put all our hands up again, but don't leave the meeting. We're going to take the cross-file Senate Bill 682 next. Would somebody move the bill, please?
Move the bill.
Second.
Is there any discussion? Does it have amendments, Erin?
It does not. It arrived in the same posture as the House bill has.
Thank you. Okay. I see some hands up. It's in the same posture as what we just voted on. I see 2 hands left. I see Delegate Hill. Do you have a question about this bill that you just voted on?
No, please. Put your,
Okay, no questions. All those in favor, please say aye. All those opposed, no. Please raise your hands. The noes need to raise their hands. All the people who voted yes on the cross-file will be yeses on this bill. And I see the same people who voted no last time, the same 8 will be no this time. You got that, Richard?
Yes, ma'am.
Excellent. Thank you very much. Okay, and thank you all for your kindness to each other as we discuss what can be a controversial issue. Senate Bill 19, Lisa.
So there are amendments. I believe they start on page 1 of your packet. And with those amendments, Senate Bill 19 is identical to House Bill 229.
Delegate Kipke. Aren't you going to move the amendments?
Move the amendments. Thank you.
Isn't that your job on bills that are identical? Don't I remember that?
I'm working remotely. I couldn't find the unmute button.
Oh, okay. Hit the space bar and just hold it down. It works really well, but someone else can help and fill in on this one. Is there a second?
Second.
All those in favor say aye. All those opposed, no. Raise your hand. The ayes have it. The amendment passes unanimously. All those in favor of the bill as amended, please say aye. Oh, wait, we need a move in a second.
So moved.
Thank you. All those in favor, please say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Senate Bill 37, Senate Bill 37. This is Lindsay.
This is the bill that phases out the registered massage practitioner credential. The Senate bill arrived with two differences from the House bill. One was to the education requirement, and the other is the civil fine for practicing without a license. The Senate reduced it from $50,000 in the original bill to $10,000. There are amendments that were circulated separate from your packet to this bill that were adopted in Health Occupation Subcommittee that match the education requirement to the House bill as it passed this committee, but keep the change from the Senate on the civil fine. So it's not the same as the other bill.
Delegate Kelly.
The subcommittee discussed this and agreed that this was the best plan, and the unanimous bill, the amendments passed unanimously, as did the bill. Move the amendments.
Second. Is there any discussion on the amendments? All those in favor say aye. All those
I
opposed.
think Delegate Hill has her hand up.
Delegate Hill.
Thank you, Delegate Kelly. A little bit more. The Senate kept the fines. We had taken them off.
No. The Senate reduced the fines from 50,000 to 10,000. 10,000 is the same level that we used for the assisted living administrators this year. I think 10,000 is sort of the new standard level we're using. So we followed the Senate's lead in reducing the fines, and the Senate is going to follow our lead in adopting the amendment that MHEC wanted in terms of educational credentials. So we're going to be consistent.
Thank you.
Okay, any other questions or discussion? All those in favor say aye. All those opposed, no. The ayes have it on the amendment. Is there a move?
The bill is amended.
There's a second. Any discussion? All those in favor say aye. All those opposed, no. The ayes have it, and it passes the committee unanimously. Senate Bill 103, Lisa.
This bill is identical to its cross file, House Bill 155.
Move the bill.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. I don't see any hands. I forgot to say that, but it passed unanimously before. So, okay. Bill passes unanimously. Senate Bill 120. Lisa.
And this bill is identical to its cross file, House Bill 180.
Move the bill.
Second. Discussion? Did it pass unanimously?
Yes.
All those in favor, aye. All those opposed, no. Please raise your hands. I see no hands. The bill passes unanimously. Senate Bill 164, Lisa.
And this bill is identical to its cross file, House Bill 119.
Move the bill.
Second. Discussion. All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 173, Lisa.
And this bill is identical to its cross file, House Bill 106.
Discussion. All those in favor say aye. All those opposed, no. The ayes have it. 173 passes unanimously. Senate Bill 306, Lindsay.
Is identical to House Bill 219.
Move the bill.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 317, Lindsay.
Is identical to House Bill 663.
Move the bill.
Second.
Discussion. All those in favor say aye. All those opposed, no. Raise your hand. The ayes have it. It passes unanimously. Senate Bill 353, Lisa.
It's identical to House Bill 1397.
Move the bill.
Second.
Discussion. All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 365, Lindsay.
Is identical to House Bill 237.
Move the bill.
Second. Discussion. All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 386, Lindsay.
Is identical to House Bill 180.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 446, Lindsay.
Is identical to House Bill 581.
Move the bill.
Second,
All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 461.
Move the bill.
This one's got an amendment that was regulated separately. This amendment makes it identical to House Bill 723.
Okay, somebody want to move the amendment?
Move the
The
Move
amendment.
the amendment.
Second,
Thank you. And the bill is now identical to what we passed previously in the House bill. All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 527, Lisa.
It's identical to House Bill 1051.
Move the bill.
Is there a second?
Second.
All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 531, Lisa.
It's identical to House Bill 636.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 611, Lindsay.
This also has a technical amendment to make it identical to House Bill 969.
Move the amendment.
Second.
Any discussion? All those in favor of the amendment say aye. All those opposed, no. The ayes have it. The amendment passes unanimously.
Add the bill.
Is there a second?
Second.
All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 628, Lindsay.
626.
Yes, I've not
Is-
seen, so
I-
thank you.
That one is identical to House Bill 1464.
So moved.
Second.
Discussion, all those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Senate Bill 682, Aaron.
We did that.
We did that one.
Oh, I'm sorry. Oh, that's right. That's that one. Senate Bill 834, the last bill of the day, Lisa.
It's identical to House Bill 1148.
Somebody want to move the bill?
Move
Move
the
the
bill.
bill.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Let me thank you all for a good week, a good voting session, good discussions. I very much appreciate you all. And with that, have a wonderful weekend and I'll see you on Monday. Remember, 3 o'clock session, not 6 o'clock. Thanks to Delegate Rosenberg. I'm aware of that. Thank you, Delegate Rosenberg. Everybody have fun. Bye-bye. Stay safe.
have a good weekend, especially the analysts.